And we were really surprised, and it was so hard to publish that. And then when you started doing your PhD, I was kind of expecting your results to confirm if what we had found was okay or not,
Yeah, yeah,
And when
yeah.
Kari was sending the first draft, I was, oh my God, they found the same. I'm so relieved.
And I think,
So but
it's
not, well, we are big fans of each other. That's truth. But also several groups did exactly the same and found exactly the same. And we are not related. We have no personal relationship with groups in Australia. And so they found the same. And it was really, okay, we did it correctly.
yeah,
And what we assumed was dangerous, maybe it's not.
no,
And so maybe we should stop putting this fear in women so they can move without getting any worse on diastasis and then on pelvic floor muscle function and everything else. So it was it's really important because still today, I don't know if in Norway you have the same, but I'm also a clinician, and still today people come to the clinic saying, well, I know I cannot do any exercise on specific strengthening exercise for abdominals, or I have to avoid moving that area. They still say it because they heard it somewhere. The social media is full of some messages that are not evidence-based, and they are creating problems where there are not. And it's so nice to have studies that show us what to think. And if maybe in some years we find different things, well, we will deal with that. For now, we should really maybe stop putting some avoidance on exercise for
good.
diastasis, because what we found until today is that it's safe and it's not going to be harmful for any of the situations that we studied. So it's a really powerful message. And it's
It
also
is.
one of the missions of this podcast to transfer this knowledge from the papers to the
Yeah.
community as soon as possible, because in Portugal, it's still a thing. I should not move because I have a diastasis. You should have a diastasis. You are pregnant.
Yes, and I think
So
there are two sort
it's
of main messages coming from my PhD. And the first message is that it's not dangerous for women to do exercises that involves the rectus abdominis muscle, but it's not dangerous for a pregnant woman to do pelvic floor exercises or transversus abdominis contractions, because the increase in the distance is only like 1.5 or 1.7 millimeters. So it's the distances are so small that it's more important that these women exercise and strengthen their abdominals and their pelvic floor muscles so that their function improves. That's the main idea. But another thing is the words that we as researchers and clinicians use when we talk to these women, because we keep on using words as dangerous or increase, or just by calling the increased interected distance for a diastasis in pregnancy. I think we should sort of avoid that kind of language. I think we shouldn't talk about a diastasis as a diagnosis until probably 12 months postpartum. That's when we can sort of start saying to women, I think you have got a diastasis, because if you measure them 6 weeks postpartum, and then if you measure them again at 6 months postpartum or 12 months postpartum, things change, because there is a natural healing. And I don't think that certain exercises will enhance that healing in regards to the distance, more to the function and the strength of the muscle, which I think is the most important thing.
Yes, definitely. And it's curious because your experience is similar to mine when I started my PhD on diastasis. No one knew anything about it, and people didn't care much. So it was hard to recruit sample because they would not send women to us based on diastasis. And now we have the exact opposite problem. So we should say, stop talking about diastasis. in pregnancy and early postpartum, as this is a big deal, because even if people don't do any exercise, which is not something that we should recommend, people should
No.
move, avoid the
Yeah.
sofa as much as possible. But even if they don't, diastasis will decrease. So this is also something that we see in research, studies on very early postpartum saying we have the answer for diastasis. Well, that's not true, because even if people don't do anything, the natural healing will bring the
Yeah.
rectus together. So why are we trying to prove that something is so great for this moment when we already know that
Yeah.
there's this natural healing, and the answer for which exercise should we recommend should be based in evidence and not trends. And in social media, it's a nightmare
Yeah.
to see the amount of misinformation that this population it's every day about bring your
Yeah.
feet level and your belly shape to pre-pregnancy. My goodness, it's hard.
And I also think that this comes from the social pressure on pregnant and postpartum women to regain their pre-pregnant body.
Mhm.
But the body changes when you become a mother.
Yes.
It's one of the most beautiful things that happen, that the female body changes, and I think it's much more beautiful after pregnancy and birth, when they've got the
Mhm.
curves and they've got their breasts increase and their bums increase and their abdomen gets like a bit. That's completely normal, and I think it's beautiful, and I think we should start using a different language when we talk about our
Mhm.
bodies after birth and pregnancies, and accept the bodies. Because I have so many patients coming to my clinic, and they come to me and they say, look at me, look at my abdomen. It looks as if I'm pregnant, but I'm not. And it's because of my diastasis. And then we assess the diastasis and measure it with ultrasound, which is a very good and valid way of measuring it. And then they probably have like 1.8 centimeters of a diastasis, which
Mhm.
basically is not a diastasis, it's normal. It's
Yes.
completely normal.
Yes.
So I think that the distance between these muscles have been blamed on lots of things that it's not, that we shouldn't blame it for. Because I think
Yes.
that when you're pregnant, you stretch the skin, you stretch the fat beneath the skin, you stretch the soft tissues you stretch the muscles, and you stretch the ligaments, and you stretch, but it's usually just the skin.
Mhm.
Well, it's basically the skin and the muscles that has got the most sort of stretchy tissue. So they sort of go back to
Mhm.
what it was before. But then I think the body remembers. So when you get pregnant again, you look more pregnant sooner, because the body has been expanded before and it knows what to do. So it just does it. So it's completely
Yes.
normal to change when you've had a baby. We
Yes.
should focus on the beautiful thing of being able to carry and produce another human being. That it comes with
Yeah.
a cost, and I think that cost, it should not be a cause of concern for these women.
Exactly. It's a very nice perspective, and I think we should definitely go for it. Embrace the change. It's
Yeah,
beautiful.
yeah,
It's
it is.
really,
It is.
really nice message, Nina. Yes. And it's completely opposite from what we normally hear. So it takes maybe some pressure from this moment of
Mm.
doing everything so well, and being happy for everything that's happening in the life. And on the top of that, go back to your pre-pregnancy body. It should not be a goal.
No,
You
it
should
shouldn't.
definitely be exercising and be fit.
Yeah.
That's very healthy. Being pressured to go back to your pre-body shape, maybe it's not healthy at all, and it's
No.
not natural. So that's a very strong message. I like it.
Yeah, but
And
I think it's very important, and also, as you say, that these women should be encouraged to do strengthening exercises. And I
Mhm.
think that by by telling these women not to do these abdominal exercises, we have made them sort of fearful of using their body. I think the female body is made to produce another human being. And I find it very surprising that the body should sort of, when the body is doing the most natural thing in the world, that then you should avoid using one of the largest muscle areas in the body. It doesn't make sense. And I also think that we should remember that these pregnant women, their body is the same. And the muscles, they need the strength in the muscles to maintain good posture and to be able to carry the extra weight, and also to get back to a functional body after pregnancy. We need the muscle strength. And also, if you look at athletes, when they get injured, or when we know that they are going to do exercises or perform their sports that will or may inflict some injuries, we strengthen that area. But in pregnant women, we actually tell them, don't do anything. We don't even try to make their bodies be able to function properly. And we should go out there and say, you should do the strengthening exercises of the whole body, because your body really needs this extra strength at this time. So get these women moving and get them to do their pelvic floor exercises and their abdominal exercise, and enjoy the feeling of a body that actually works.
Exactly. Yes, I think we should do a statement like that.
Yeah.
It will help so many people.
Yeah.